You have 200 seconds, Kim.
Thank you.
Take it away.
That's very loud. So we help people who have brain injury caused by stroke or neurological disorders like depression, Parkinson, or Alzheimer's to recover their fundamental cognitive brain functions and restore them to full health and daily life ability. We do this by engaging people on a digital mobile platform which is clinically validated, where they train with a combination of high-intensity cognitive exercises and metacognitive therapy. So let me demonstrate this for you. It's designed for people with mild to severe cognitive impairments. So it's built to be extremely easy, intuitive. So on a daily basis, all a patient has to do is open the app and press start. So let's jump into one of the cognitive training exercises. This one is an example of an exercise that trains working memory capacity, dual tasking, and task switching. What these different games, or we call them neurogames, do is that they challenge the cognitive system to the edge of its ability. So we basically pressure the system and stimulate it so the damaged neurological structures will rewire and rebuild. This is only possible because the training is so intensive, so targeted, it's personalized, and it is continuously and automatically updating all the time to the ability level of the patient. So that's the only way we can do that. The first thing that happens when a patient gets on the platform is that they go through a series of assessments where the platform will basically identify cognitive strength and weaknesses. So they take these 4 assessments which measure 8 abilities. Based on that, the program will tailor a personalized training program consisting of the neurogames and the other key element, which is the metacognitive therapy, which is both teaching and training. We call it the brain coach. And the way the brain coach works is simply that you put on your headphones and you listen. Then the brain coach will, during 5-10-minute sessions, teach people how their brain works, teach them brain healthy habits, teach them how to reduce lifestyle risk factors for brain disease, and actually do guided exercises like mindfulness or like metacognitive attention guiding exercises. The patients train with this on a daily basis, 20 to 30 minutes per day. We already have positive evidence on this from pilot trials in stroke, in Parkinson's disease, and we have randomized controlled clinical trials running, 13 of those, in also Alzheimer's, depression, stroke, acquired brain injury. We're co-developing this, testing this with leading institutions like the Karolinska Institute, Aarhus University, Copenhagen University, Nottingham University, Alzheimer Europe, the European Brain Council, the Danish National Center for Neuropsychiatric Depression Research, many hospitals and municipalities. So it's all science-based and it's all being clinically validated. We are live in Denmark, used in clinical neurorehabilitation. And as you can see, everything is designed about an easy user experience. For the user, it feels like playing a casual game, but it's really a very sophisticated scientific engine underneath the hood. Thank you.
Thank you very much, Kim. That was a lot towards the end.
Sorry if I speak a little bit fast.
Please, 2 questions from the panel, 1 or 2.
Thank you so much for an impressive presentation. I come from the patient side, so universities are very impressive, but what's the retention rate in the app? I mean, how many patients that start the 60-day program does actually finish the program?
So we have retention rates that are over 90%, and this is in the clinical setting. So that means that they have clinician support, and the average length of such a program is between 8 to 12 weeks. And then they can continue, but that's kind of the standard treatment.
You mentioned that you were live in Copenhagen. Can you
in Denmark.
In
Denmark.
Can you explain that a bit more?
So that just means that we have already released the product for clinical use. So we have our first 3 municipal customers using this for neurorehabilitation of citizens with, for example, brain injuries from stroke, from trauma. We're used in the social psychiatry setting as well. We're being used for job rehabilitation in one of the municipalities. So that's what I mean by being live in Denmark.
Thank you very much, panel. Thank you very much, Kim.
Thank you.
Brain Plus is also part of Health Tech Nordic, and Kim is working from the booth just outside. So come and ask him to demonstrate their games or try your own ability.
Thank you.
Yeah. Thank you very much.